Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant and clinical lead for medical oncology and hematology at Bhagwan Mahaveer Jain Hospitals, Bangalore. With me is...
Hi, I'm Dr. Sudhindra. I'm the clinical lead and consultant in the pain and palliative care unit at Bhagwan Mahaveer Jain Hospital.
All of you must be aware that Bhagwan Mahaveer Jain Hospitals has opened a comprehensive advanced department of oncology and pain and palliative care. And together, me and my team of oncologists and pain and palliative care specialists are planning to have a series of videos for your education. Many people have this conception that advanced cancers is basically nothing but one step before death. Unfortunately, that is not the truth, and together Dr. Sudhindra and myself are here to bust the myth. Previously, stage 4 cancers used to be considered basically as a give up stage where you don't do much. But now, as clinicians, we divide stage 4 cancers into early stage 4 and terminal stage 4 cancers. When it comes to early stage 4 cancers, medical oncologists like myself, we give multiple kinds of therapy such that chemotherapy, immunotherapy, target therapy, and collaborate with my team of specialists so that the quality of life of these patients can be made better. When it comes to stage 4 terminal patients, what we do is we make sure that the patient's existence is comfortable, the patient passes away with the least of issues and less suffering for the patient. So, Dr. Sudhindra, when we see patients with stage 4 cancers and we all see these patients together at the multidisciplinary team, what do you do so that the patient's symptoms can be managed for?
As Dr. Mangesh Kamath has rightly said, it is very important to focus on the palliative aspect of things in a patient with terminal cancer. Basically, this will deal with providing relief from a lot of symptoms that these patients have and thus improve their quality of life. This does not mean the treatment for the cancer stops. The palliative care is a continuum and it coexists along with the treatment of the cancer.
So that's very rightly said by Dr. Sudhindra. The patient does not care how much tumor is inside, where it has spread. Patient bothers about whether my symptoms have been taken care of or not. So there are two aspects of taking care of any cancer for that matter. One is making sure that the symptoms can be made better so that patient can have a very relaxed kind of a living. Second is to make sure that the cause of these symptoms are reduced. So how do we do that? By giving therapy such as chemotherapy, immunotherapy or targeted therapy. So Dr. Sudhindra, whenever we have these patients who come with lot of back pain because of spread to the bones by the cancer, how do you approach these patients? Along with that, they must be having this loss of appetite, nausea, vomiting and all those things. So how do you approach these patients?
As you rightly pointed, Dr. Kamath, there are multiple symptoms that bother these patients, most commonly pain, but these symptoms are not limited only to pain. There are many other symptoms like shortness of breath, fatigue, loss of appetite, nausea, vomiting, depression, anxiety, and also sleeplessness. And also along with that, we also need to take care of the family and the caregiver.
Yes.
Because it is very, very important to have a holistic view of the things, because pain is never only a physical thing. It is a psychosocial phenomenon with a lot of social factors involved. So we thus take a step back, take a bird's eye view of this patient's symptoms, conditions and the caregiver's concerns, and then provide holistic care in terms of multiple ways like physical modalities, pharmacological medications and certain pain interventions.
Yes, so that is very important for all of the viewers to note, is that we don't only focus on the cancer treatment, we focus on the holistic treatment of cancer. One is pain and palliative care, two psychotherapy. I mean, you need a lot of psychological support for both the patient and the family. And 3, not to leave the fact that you have to continue treating the cancer. We have seen in our practice so many patients who are in stage 4 who are going on to live 2 years, 3 years, 5 years, and in today's world almost even a decade of survival is possible. Like in men who have prostate cancer, we have so many patients who are surviving. All they require is some of the symptoms that are there. Could be the bone spread by the prostate cancer can be taken care of.
Yes. The other normally the patients that ask us is, if my oncologist has referred to a palliative care doctor, does it mean that he has given up on me? Definitely no, definitely no. As I told you previously, palliative care focuses on relief of symptoms, providing quality of life, and thus prolonging life with a meaningful way of living, along with the fact that cancer treatment in terms of immunotherapy, chemotherapy, as Dr. Mangesh Kamath mentioned, it goes on.
So now that we have understood about the fact that treatment by the medical oncologist and treatment with the pain and palliative care specialist goes hand in hand, we now have to look at specific situations. So Dr. Sudhindra, let's have a few discussions. So let us have a patient who has come to me with prostate cancer. The prostate cancer has spread extensively to many parts of the bone. Patient has come with lot of pain, bone pain, patient is unable to sleep and all that. So my line of action is to go ahead and do what we call as orchidectomy, that is removal of the testis of the patient, and then we start the patient on either targeted therapy or hormonal therapy or chemotherapy. This is how we usually manage that. And because the cancer has spread to the bones, we usually give what is called as injection zoledronic acid or bone cement injection that I popularly tell the patients about. How do you manage this patient?
So basically, as we have already been discussing, any patient with an advanced cancer with multiple pain problems, we have to take a holistic view of the situation. As I think in this situation, the most important symptom of the patient is pain. So we have to deal with it. And as you would know, there are multiple types of painkillers. One of the most common over-the-counter available painkillers. But more often than not, these are not effective in cancer pains because of the severity of the pain, which basically means that we'll have to go with higher variants of painkillers, what are called as opioid analgesics, and in common terms it's either called fentanyl patches or morphine tablets. The moment somebody utters these words, people get afraid that, oh, these are very strong medications, what will happen, will I get addicted and stuff like that. To be honest, the risk of addiction to opioids in a cancer patient is extremely low, so we need not worry about it. Used under proper supervision and education, these are extremely effective and can improve the quality of patients' lives. Obviously, not only the patient but also the family needs education in terms of what to expect of opioid therapy, what are the side effects, what are the ways to decrease side effects, and with routine follow-up we can manage the pain very effectively. Opioids is only one part of the treatment. We also use other medications like non-steroidal anti-inflammatory drugs and occasionally steroids as well. Sometimes we also use physical therapy, something called as kyphoplasty, where a small amount of cement is injected through a needle into a very painful bone when there is a localized disease. This is decided on a case-to-case basis. As I told, the whole pain management and palliative care approach is a tailored approach based on the patient's pain, patient's needs and the family's situation.
So once, as Dr. Sudhindra said, we take care of the entire pain and support the patient well, while the therapy that I am giving to the patient acts in tandem, you will find that the same patient who came with excruciating pain, in a matter of 2 or 3 months will be able to walk by himself and will be able to do all the activities of daily living. So cancer has been controlled, symptom also has been controlled. So we need not wait for one after the other. We have to do it at the same time so that we have to give the best quality of life. Same goes with breast cancer, hormone positive breast cancer, which spreads to the bone as well. You would have seen a few cases of breast cancer who have had bone spread.
I mean, I'm surprised that you're asking this question because incidentally I just came down to this interview after seeing an unfortunate lady with terminal breast cancer who has multiple mets all over her body. Obviously, her treatment is still going on from the oncology side of things, but we do a lot of pain management techniques like as I told you, opioids, non-steroidals, and also we use what are called as anti-nerve pain agents, because these bony metastases sometimes can affect spinal nerves and other nerves. These medications again can make a big difference in the quality of life and the sleep duration, the sleep quality of patients. Overall, it is important to assess the patient. Yes, we might not be able to cure everyone, but we can definitely care for everyone.
So we just wanted to put across to you that it is not the dead end when the patient has stage 4 cancer. Definitely things can be done. There are a lot of success stories. We will definitely highlight many of these stories to you in forthcoming videos. We just wanted to give you an introduction to the advanced comprehensive cancer care that is available at Bhagwan Mahaveer Jain hospitals. Thank you.
Thank you.